Good day, ma'am. Today I will be performing the Oropharyngeal and Nasopharyngeal suctioning checklist. Rationale: suctioning via all of these routes are indicated when the patient has secretions in the pharynx and upper airway that they cannot clear independently. So first is to assess the need for suctioning, including respiratory assessment, signs of hypoxia, inability to clear all secretions adequately, alterations in oxygenation levels. So perform baseline respiratory assessment. Then, position the patient. Clear? So, rationale, this promotes lung expansion and promotes secretion clearance. Then, perform hand hygiene. And then next is to gather the equipment. So here I have prepared the suction machine, canister and liner, suction catheter, lubricant, sterile saline or water, PPE such as sterile gloves, face shield, and gown. Now, I will ensure that the suction setup is working. Then, administer oxygen if needed. So note, hyperoxygenating might be necessary if the patient is hypoxic or at risk of hypoxia. Then, estimate the appropriate suctioning depth by measuring the catheter from the tip of the patient's nose to the end angle of the mandible or to the earlobe. So here, to the tip of the nose and the mandible according to the earlobe. Here. So note that this is done with the suction catheter still on the sterile package to ensure that the catheter remains sterile and a minimum reaches the pharynx. So here I have measured. Then turn on the suction device. And set the vacuum regulator to appropriate negative pressure. So set suction levels to medium or moderate. Now I will be attaching the suction catheter to the tubing whilst remaining in the packaging, sterile package. Then, I will now open the sterile water or saline. And if using lubricant, squeeze water-soluble lubricant onto sterile surface. Then, I will now be performing hand hygiene and to don my PPE. Note, at minimum PPE should include sterile gloves and face shield. So sterile gloves and face shield reduces risk of transmitting microorganisms into the lungs. Next is to apply sterile gloves. Then, with the non-dominant hand, pick up the package connecting tubing. Then, expose the suction catheter through enough to allow the dominant hand to grab the sterile catheter. There is more than one way to remove the sterile suction catheter from the package. The principle is keep the dominant hand on the suction catheter tip sterile. Wrap the catheter around the dominant hand and suction a small amount of sterile NSS or water. So, suctioning sterile NSS or water ensures properly functioning equipment. Then apply lubricant if it is necessary. Then insert suction catheter via route of choice. Here I will be using the oral route. So I will insert. And until I feel that I'm in the pharynx already, or until I feel resistance. And then apply intermittent suction as catheter is withdrawn. So occluding and releasing the catheter vent with non-dominant pump. So some sources suggest twisting catheter back and forth as the catheter is withdrawn. Rationale: do not apply suction for longer than 10 to 15 seconds. Suction removes oxygen and increases the risk of hypoxia as oxygen is sucked out. Then, replace the oxygen delivery device or oxygenate the new one. Then after that, I will be clearing the secretions from the suction catheter by suctioning sterile water saline to clear tubing of secretions. Rationale: it clears tubing of secretions to maintain patency. Then, I will assess the need to repeat the procedure and to observe for changes to cardiopulmonary status. And discard suction catheter, sterile gloves, lubricant, and sterile saline water. Then, document the procedure in the patient's record. Next is the suctioning with a bulb syringe. So here, I will be squeezing the bulb syringe, squeeze the air bulb, and keep the bulb squeezed, and then gently place the tip of the squeezed bulb into the mouth or nostril. So here I will be putting it on the mouth. So sideways only. Then release the bulb. To let the air back into the bulb and release the mucus out of the mouth into the bulb. Then after that, I will be recording the amount, consistency, color, odor of secretion, and newborn's response to the procedure. So that's all. Thank you.